famous, Aaliyah.
I'm gonna be famous.
All right, so you wanna make sure that your client is cozy, comfortable, and warm. You also wanna make sure they're positioned properly, and it really doesn't hurt to kind of take your time getting ready so that you are working comfortably. The first side of your wrap that goes down is the side with the flap, okay? Because this is what's going to be tucked in like this,
Look at that.
okay? And then now you can adjust it, all right? And so what, if it loosens up and it starts coming out, then you
can
know
just
what?
put it back.
You just put it back. Nobody knows a thing. Okay? I do a little sweep across the
Mhm.
ear so the ears aren't all bunched up. I have a big ear thing, because I've always had big ears, so when I do different things, my ears always get caught in everything. So this way, you just make sure you check on her that she's okay. All right, our first step is our analysis. We're gonna turn on our little googly goggles here. And we're gonna take a look at her skin and say, is the skin safe to touch, right? So Aaliyah and I are working very diligently at clearing up a lot of what she's had going on. Her skin has improved by leaps and bounds. It looks so good, I could just cry. But to be on the safer side, because she does have some open areas for her protection, I'm gonna go ahead and put on gloves, because the last thing I wanna do is spread anything that might be in
Mhm.
my fingernails on her skin. In her natural state, I do see just a little oil sheen. So obviously she's a client that has a little oil production going on. And we're gonna check back in with that. Your day class was slacking on the restock today.
Oh,
We're
no.
running on all kinds of things.
She's getting
So weird.
more
Perfect.
famous.
Thank you. I think we were just super busy today. We worked right up to the end.
Yes.
So you wanna find gloves that fit you nice and tight. Okay? This way they don't feel like loose plastic bags on their skin.
Mhm.
We're gonna go ahead, and I forgot to put her little goggles on her, guys. So I'm already slacking. We're gonna start with our creamy cleanser first. And you just scoop it out onto your hand with your finger. You're gonna take a little water, and you're gonna mix it up, and you're gonna emulsify it into your hand until it gets nice and soapy. And then you're gonna start here on the forehead. This is what I call prayer hands. Gonna do some prayer hands. You're gonna sweep down. You're gonna go down to the neck, and then you're gonna wipe the décolleté around the shoulders to the back of her head. This is her occipital ridge. So we wanna put a nice little pressure on there, and we wanna use this as our starting spot, and this is our ending spot, okay? You can come in here and you can work the product around a little bit. With Eminence, it's very common, because her skin is also absorbing as we're placing the product. It's very common for it to start absorbing before you're done cleansing. Instead of needing or getting more product, what you have to get in the habit of with Eminence is just adding more water, okay? So we just take a little water, we re-emulsify, and look at that. All of a sudden, it's not so sticky, and now it's spreading really nice and evenly. So tonight, we're gonna practice these nice long movements. These are called effleurage, okay? And anytime you go to touch the skin, or you go to remove your hands from the skin, I want you to imagine touching a butterfly, okay? You don't wanna just put your hands on them or be working real nice and then release your hands, because it's gonna interrupt the flow, it's gonna interrupt how relaxed they are. So you're touching like you're kind of landing an airplane on butterfly wings, okay? Now your cleanse does not have to be fancy. We're trying to give them the best cleanse they've ever had in their life. So you do want to make sure that you're getting in all the nooks and crannies. I even get back behind the ears, and I even do the ears.
Mhm.
Okay? And why are we doing the face, neck, and décolleté? It's because the entire facial is face, neck, décolleté. So we need to clean it first before we go in there and do anything else to it. We're gonna take our sponge and we're gonna wring them out. We're gonna wipe our hands off. We don't wanna give her a bath. And then I'm gonna go ahead, do you mind flipping that thing off? I'm gonna go ahead and it's gonna take you guys a little while to get used to these, but I put them in between my two middle fingers and I just do a nice little hand over hand. Every portion of your facial should feel nice and relaxing. So even though we're just cleansing the skin, you don't want to be like blah, 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 and going crazy. You actually do want to take them through a nice relaxing removal. Everything should feel good, and most importantly, everything should be symmetrical. So it would kind of interrupt someone's relaxation if I were just to do this and be like, oh, we're done. Okay? So if you want to keep it symmetrical. I just had like this flashing moment that I didn't hit record. I was like, oh. We're going to do a full removal. Now we're going to stick these back in the water. We'll use them in just a second. Next, we're going to do our gel cleanse. We're going to add some water to it. Now we're doing a gel cleanser, so it's going to get super foamy. And we're going to do that same pattern. We're going to do our prayer hands. We're going to go down. We're going to wipe the neck. We're going to wipe down the décolleté and the back to the occipital ridge. Now we're going to come in here and we're going to work. Roll around, make sure we get everything super duper clean. And we're even gonna go on the ears. What's really great is you can use all parts of your hands. You can use fingertips, you can use your palms, you can use the sides. You can get really nice and creative because you have whole hands. I've seen some estheticians and they only do this.
Mm-hmm.
And it's a wasted opportunity. You've got these nice hands, they do lots of good things. So you want to use the whole hand. Give her a really nice cleanse. We pull back in, use our little sponges. We're going to wipe the backs of our hands off. I want to give her a shower. And then we're going to go in. We're going to do our removal. Hand over hand, keeping it symmetrical. We can even flip them over and get the other side. And we're going to move it back. And we're going to remove the décolleté. Well, Karen doesn't have a décolleté, so we're just going to stop at the neck. All right, next step is to go ahead and do our second analysis. So now that we're seeing her true skin, everything free and clear of dirt, debris, oil, makeup, now we can definitely tell that the oil has been removed, so it was surface oil. You can really see her pore size, and you would be able to tell, okay, well, some of the skin conditions I see on Aaliyah is that she has some active portions that are still kind of actively breaking out, but a lot of her skin has healed and she's actually dealing with the pigmentation that comes with breaking out and some of the scarring. So we'd want to make sure in talking to her that her concerns are those same things and that we can kind of help her with all those things. And I would base the rest of my facial off of what I see in her skin during the second analysis. It's also a really good time for you to make sure that you got all the cleanser off of her, because it is dark and sometimes you miss things. Okay. Next up is her scrub. And with the scrub, like I said, you guys are just gonna roll it around for about 60 seconds. We're not trying to scrub off any skin. We want her to have skin when we're done. But we do want to start now the process of dipping into our clean water. We're just gonna take a little water. We're gonna emulsify it. And we're gonna go ahead and just work around in circles. A little scrub action. We're gonna take it face, neck, décolleté. Need a little more water, some more water, re-emulsify. And this is a super gentle scrub. You barely even feel the rice and chickpea powder. More of what's actually doing the exfoliation is the lactic acid and the salicylic acid. Okay. 60 seconds, that's all you need. Now we're gonna go ahead and remove this, but because we're dealing with scrubbies, we're gonna go for our hot towel. Be careful of your hands if you're on this side. And we're going to fan this out just a little bit. And then we're gonna take that same pattern as we did the hair wrap. We're gonna do the upper left-hand corner with the bottom right-hand corner. We're gonna make your upside down mountain peaks. We're gonna put her neck right in the middle of the mountain peaks, and we're gonna lay it flat across her décolleté first. And we're gonna do little kitty cat paws. Push in some of that heat. It's nice and relaxing. And we're also trying to take some of the heat out so that when we're ready to go to the face, it's not quite as hot. Okay, we're gonna go over the lip, and then we're just gonna tug them up to the top and do some compressions. Go ahead and try this puppy back on. Let's see, nice angle. Thank you. The only place you don't want to push down is over the eyeballs, because you might need those to see. And if you notice, we have left her a blowhole. She's got to breathe, okay? A lot of times I see people and they just kind of flop the towel over them, and I'm like, no, you want them to live, you want them to survive, so you have to leave them a blowhole. Now, if you've done this correctly, you now have these cool little mitts to put your hands right in this crease here. And just like with the sponges, you want the removal to be nice and comfortable. So you want to go ahead and slowly remove. Make sure you're getting all the scrub. Kind of change places on the towel so that you get a fresh part of the towel. Certainly want to make sure you get into difficult areas like the little nostril area. I'm going to go across the lip. The lip gets forgotten about. It's a very lonely area. People might put product in it, but then they forget to take it off, and then you just got a weird little stash going on. All the way around, everywhere we put that scrub. Any questions so far?
Yeah, I have a question.
Yeah.
It's just kind of because like when you're doing, if someone has like piercings, for
Mhm.
instance, like
Mhm.
eyebrows, lips, nose, and you're removing, how does that, you try to just go around
You
it?
try to go around them.
Okay.
Yeah, just be careful. All right, I'm gonna go ahead and dispose of these gloves. Take a drink. And notice I have the steam going down this way. It's a lot more comfortable this way than going right up their nose. It just means that you have to kind of feel it out. They might not be getting the steam on all sides, so you want to definitely watch where the steam's going. And then when you get up to do your arm and hand massage, you want to keep an eye on the steam because you want to definitely check in with them. How's it feeling?
Good.
Okay, make sure they're comfortable. But then as you work, if your AC kicks on, the steam just goes whoop, right into the air. So you want to just kind of keep an eye on your steam and make sure it's still on them. Now to avoid the icky trying to get gloves back on after I've done arm and hand massage and my hands being all lotiony, I'm just going to go ahead and keep gloves on for the rest of the facial. Now, guys, I know it kind of goes without saying, but I'm going to say it. But your steam is hot. So don't grab it by this part. It's hot. Don't move it by this part. It's hot. Touch it up here and touch it down here where it's safe. There will be a time when you're in a rush and you're going to grab it in the wrong spot and you're going to go, yeah, that hurt. All right. So your arm and hand massage, a lot of estheticians, it's kind of gotten lost on them where they don't really do it anymore. I don't know why. It's a wonderful opportunity to really relax your client. And so with your arm and hand massage, we didn't dispense it today because Karen doesn't have any arm and hands. But you're going to use the Biotone lotion that's up there. And it's just a nice generic lotion that gets you pretty far when it comes to doing massage. And your posture is everything, right? If you are sitting here doing this, I'm going to come correct you because you're going to blow your back out. You really need to go into a lunge and you need to keep your back straight. And when you work and you put any pressure down, it really needs to come from your core and your body weight and not just your hands and not just your arms, okay? So when we apply the product, we're actually going to go up the back of our shoulder. And we're estheticians, right? We're not massage therapists. So we are just applying this lotion to her arms, and we're doing it in a nice relaxing manner. We are not going into a deep tissue massage. So if you have a client that goes, oh, it feels so nice, go deeper. That's always a tough spot to be in. So we're going up and around the shoulder. We're going to go ahead and around her shoulder. And then really, you want to put any kind of firmer motions up toward the heart. So sometimes I just use my knuckles and then give her a little push up her arm. And then come back around. Her forearms, the same. You can kind of push them up toward the heart. Steam still okay? Mm-hmm. Check in with her. You feel like you're running out, you can get a little more, or you could tap in your water. And we're going to come into the hand. You want to try to work and spread open the palm. You can work the little carpals. Think of what would feel good to you. And you're going to do about 2.5 minutes each hand. Okay, the steam should be on about 5 to 7 minutes. About 2.5 minutes each hand. This is a good way to go. You can work into the fingers. Do not pop their fingers. When I was in school, somebody broke someone's pinky finger, so don't do that. Just, I'm just kind of sliding down them. Okay, you can work in the webs. There are some awesome moves you could do. How you get in here. Work inside the palm a little bit. And then you want a nice strong finish so that it feels really nice. You can go back up to your neck and back down. light as a foot. Okay. You don't want to just be massaging and then like, oh, 2.5 minutes up. Okay, next one. Oh, and I got so excited I forgot to take it off. I forgot to take the blanket out of the way. Go ahead and spread it out. Go into your lunge. And come up the neck. Around the shoulder. Then you could do these little upward pushes. And when you get into the forearm, you can do little circles. And work with your hands. And fingers, working the webs. And we'll go back for a strong finish. Where we go all the way back up, around, down, and we can finish strong. We can tuck her back under. And this is where oh my gosh, English is hard. Where we would be doing extractions. But since we're skipping over that part, we're just gonna go forward and we're going to apply the mask on her skin. Right now, all her pores are nice and open, ready to receive all the wonderful things. Fresh water is going to be a little on the cold side, so I heat it up just a little extra. Now we're going to go ahead and apply it. Come back in here. Get your upper lip. Nice and spread out. You can massage it in a little bit. You'll start to notice that it's absorbing right in. Now this mask doesn't look like the traditional face mask, does it? Typically you see those big green thick masks and the cucumbers on the eyes. Eminence is not that kind of mask. Eminence is very much so as thin as you can get it. You want it pantyhose thin because you want it to absorb. If there's product left on the surface, that means it didn't go into the skin, so you've just wasted a bunch of product. So the fact that you don't see it anymore and you literally will see the skin kind of sucking it in, that means it's actually taking everything in. Do you see those masks where it's just this thick layer left behind? The skin obviously didn't absorb it, so what's left behind is all the gunk. So you don't want that. What we do want to do is, now that she's really nice and masked up, we're going to go ahead and do her massage. We're going to go ahead and start in the typical fashion. We're going to just spread it out. Now, generally, when you have someone who has a lot of active or inflamed acne, you're not going to do much in the way of massage. I don't think, you don't necessarily respond to massage that way, right? Okay, because we've massaged her a couple times and we've not really had any issues. It was Alyssa who had the issue. So we're going to go ahead and demo a little massage for you so you get some angles. Typically, I do start on the neck and the décolleté. And I do this because we have a lymphatic system, and we need to kind of start by draining the first half of the lymphatic system, and the second half of the lymphatic system, and then finally the face, and then we drain it all back down to the neck and décolleté. You guys will actually learn a facial lymphatic drainage when you're ready, but for now, I kind of get my students ready for that by working the décolleté first. So we're just going to do some circles along this little pectoral muscle. We're going to take it around the back, and we're going back to home plate here on our occipital ridge. Now, a lot of people mistake this for the occipital ridge. This is not it. It's behind, okay? It's right where your hairline meets your neck. So we're going to do these nice long motions, and we're going to give a little pressure. Drain it down, around, give a nice little pressure at home base. Down, around, and get to home base. The best thing about your client is that their head moves. So we're going to go ahead and move her head a little bit to the side, and we're going to go around, and we're going to do these really great sweeps behind the neck. That's my pressure, okay? While she's bent this way, we can kind of come in, and we can push down, and we can do a little love to the trapezius. Again, we're not massage therapists, so we're not trying to massage out all of her lumps and bumps and all of her stressors. We're not doing it, but we are going to give her a little love in this area. Now when we go to flip over to the other side, I'm going to gently move her very slowly. And I'm just going to push her to the other side. Notice I didn't just shove her head over. Okay. We're going to come up and do some sweeps behind the shoulder. And over here, we're going to just do a nice little hook. And we're going to work a teensy bit into the trapezius area. I had a facial once where I was like, Uncle, Uncle! The lady was hurting me so bad. I'm like, oh my God, you need to be a massage therapist. You have a vice grip on that hand. Now we're going to move her back, so I just take one long sweep across. And I come around and I gently. Now we can just do some little sweeps. Just do a little drainage. Now we don't want to go with gravity too much here. We just want to do some little sweeps to drain anything. We will want to do some fun stuff with the actual movements of upper massage where we're stimulating collagen. So we're going to work in these cool little, I call them lobster claws, where we're going to, our home base is actually the jawline, and we're actually sweeping up the neck. So now that we've done a little drainage, now we can work on turkey necks. 'Cause some people got them. You want to be careful in the center of the throat. Don't want a karate chopper in the trachea. Do some little lobster claws here. Okay. And now we're going to start to work the face. So we'll start along the jawline. Little pinching motions are a really nice way to break up the adhesion in the skin. And it's gonna be difficult for you guys when it comes to doing a full 10-minute facial massage. So my advice to you would be doing everything at least 3 times. So if you do circles along the jawline, you take it from chin to ear, and then you go in, you go, okay, there's one, you roll up to the front, do it again. It's gonna help you to fill up your time. Especially when you have clients who don't have any extractions and you have a 50-minute facial with them and you need to fill 50 minutes, you're doing a lot of massage. A nice way to do it is to do every motion at least 3 times. And some full motions. When you guys get a little more advanced, we're going to be working with Eminence Organic Skincare's Hungarian facial massage, which is a proprietary massage meant to stimulate the muscles of the face. It is fantastic. It's incredibly difficult. Leah's class just had to do it.
It was a lot of fun.
Yeah. I'm gonna work up the face, look in the cheeks. You can feel along the cheekbones, do some little pressures. And do some nice big circles around the eyes. And then you can go into figure 8s. Pressure in the sinuses is a real problem down here in Florida. I don't really know many people who don't have days where their sinuses or their allergies are bothering them. So coming in and working around the sinus areas is really beneficial. You can do these really nice little firm pressures along the jaw, the eyebrow bone. Auricularis oculi. Little X's and corrugator muscle. This is where we have our little frowny lines, our little 11s. Do some X's in here. And take those X's a little bigger and do the whole forehead, pulling up the brow. And then you can kind of pull back on the forehead. And once we feel like we've done a pretty good job at massaging our client, go down for that long sweep and drainage motion, and then we're going to go to the scalp. So with the scalp, if your client has just had her hair done, it's a problem. Most people already know when they're getting facials to not come in with beautiful hair, because we're going to mess it up. So you're going to work along the occipital ridge down here. Circles feel fantastic. Good body hold. have stuff in their hair and then you're just gonna go around it, it's okay. It's better than sitting there fighting, trying to pull out a bobby pin.
Mhm.
Go on the temporal region. Just think about what feels good to you. I mean, that's a pretty good indicator of what you should be doing. There's all kinds of scalp massage techniques you're gonna learn, but for the time being, I just want you to kind of get familiar with touching someone's scalp and face and some more awkward areas. Kind of run your fingers through. This is typically the time when they start getting really sleepy. And this is your time too to really pamper them if they, didn't have extractions and you have a lot of time. You can do a lot of creative things with the scalp, including moving their head from side to side and really kind of getting in to the underneath of their hair. When you're all done, you do want some kind of big finish. I like to kind of do some firm pressure. Stop, give her a little compression there. And then I like to just kind of gently release. Go ahead and tuck her back in. And now we're going to remove her mask and massage cream. I'm going to be working with the towel, so I'm just going to give my hands a little break here in the gloves. Now your towels are hotter than ever because they've been in there for a long time. So you're going to shake them out a little more. A good indicator to find out how hot they are is go on your forearm. If you can handle it on your forearm, they're probably fine. But we're going to drape it over their décolleté first, just in case. Release some of the heat onto their chest. Hot towels are really nice and they feel really good, but they're actually not the greatest thing at the end of the facial. So some estheticians have kind of abandoned hot towels for room temperature towels or cool towels. Certainly if somebody was super red and inflamed and irritated, you're going to try to stay away from heat. So you could fan them out a little longer, or if I know that's the case, sometimes I'll just take them out of the hot towel cavity and I'll throw them over the arm of my steamer and I just let them air out. So by the time I'm ready for them, they're nice and cool. We're going to go ahead and fold this up and I'm just going to leave her that little blowhole. I have my hands in my little mitts here and I'm just going to slowly wipe off all the product. You want to make sure it's all off. Hi. Again, about her yawning upper lip. And underneath. It's one of my pet peeves when I go get facials is that sometimes you just feel like the product is still on even after they've wiped everything off. So I work really hard to make sure it's all off. You can even throw the towel over your hand, twist it so you have like a little glove, and you could do a removal this way too. When you're done with your towels, they go in your little bin underneath you there. And I'm gonna let her skin just breathe for a second and look it over. It looks really beautiful. A lot of the inflammation that I saw when she came in is nice and cooled down. We're gonna tone, so I do a little cover over their eyes, and I don't squirt her face. I actually go past her. And it falls as needed, and then I remove my hand and it'll fall where it needs to go. I do have some clients that don't really like the toner, and you can spray it in your hands and pat it in. Okay, that's an option too. Now your toners, remember, they're gonna help restore a friendly pH for the skin. It's also going to be like a double-sided sticky tape, so that whatever you put on after, it's gonna help penetrate and stick to the skin. So the next step is your serum. Well, what did we talk about with serums last night? Does anybody remember? These guys are concentrates, and these are super small molecules. They penetrate really quickly. They're not meant to stay on the surface of the skin at all. They're meant to go right in. So typically, it's better to kind of pat them in, and then once they're all here, once they're all spread around, then I go in and actually work the rest of them in. But you'll feel it immediately get tacky, and then within a few seconds it's gone. Her skin just goes, thank you very much. And then we're going to use the Clear Skin moisturizer on her. And this one we can go ahead and put on, as we are used to putting things on. And you want to rub it in until it's gone. You don't want to be like, yep, you're done, and then they still have all of this puck on their face, right? You want to rub it in until it's gone.
Yeah, no stripes.
No stripes.
No stripes.
No stripes.
The worst thing, I hate it, every once in a while it happens. My client will leave, and if I did like a more, advanced mask on her, sometimes there'll be like a little mask left behind that I didn't see in the treatment room, and I'm like, no. Because once they're out of the treatment room, it then again becomes inappropriate to touch somebody in their face. So it's like, let me get that for you. You don't want to do that. So you try to make sure you get it all. Clear Skin moisturizer, especially if you put too much on them, it just sits on top of their skin. So if you're having a really hard time getting it in their skin, then just make a mental note, okay, next time I'm going to use a little less of that moisturizer.
There's no sunscreen.
Nope, Eminence did not give us a sunscreen in our kits, unfortunately. Now you certainly can in your treatment room if it's between the hours of like the morning and afternoon, top it with a sunscreen. I typically do. But for your learning purposes, you just have your Firm, Clear, or Calm to choose from. Now you're going to unwrap their hair, ask them how they're feeling.
Good.
Fantastic.
And
Yes,
then,
amazing.
good. And then typically if you're dealing with a client, and we're not going to need this